My name is Cynthia Njuguna, and like I promised you that you're going to be hanging out with Dr. Ndirangu Mugo in studio today, talking matters about UTI. I know that we have so many questions about that, and I'll just let him introduce himself. Kwanza kabisa, before we talk about urinary tract infections. Karibu sana in studio.
Asante sana.
And it's good to see you again.
It's good to be here once more.
How have you been?
Been well.
Merry Christmas.
Asante. Merry Christmas to you.
Just introduce yourself to MBA Dr. Ndirangu ni nani, and then you can pick from there very fast.
So Dr. Ndirangu Mugo is a young man who's passionate about healthcare, works at the Mater Hospital, and I'm excited to be here. Yes.
Karibu sana. I know that you do a lot of many things, but you can't just say them here. So you come out, I feel shy, but it's well. We thank God for you. It's good to have you back again on PAL Radio and also on PAL Play as we talk about matters our health, because our health is our wealth, right?
That's right.
So today we're going to be talking about matters urinary tract infection, and many people, I included, we really don't have idea, or we are not really knowledgeable about a UTI. And maybe you can just start by clarifying to us or explaining to us what is actually UTI, because there's actually UTI and STI. Those are two different things, by the way.
Yes.
So to explain here, UTI ni nini?
So we'll just go to some basic science first off. So basically, we'll talk about the urinary tract, which is equivalent to sort of like a sewage processing plant in simple terms. So we have four main things. One is your kidneys. Then there's a pipe that connects your kidneys to your bladder called the ureter. Then, so the kidney is the organs. I usually have two of them. So the kidney, what it does, it helps to filter the blood and remove waste products mainly. It has other functions, like it also helps to maintain the acidity ya damu, and it also has a function to produce a couple of other hormones. All right. So basically, you have about 5 or 6 liters of blood in an adult running through your body, and it's going to pass through the kidney about 600 times in a day.
Wow.
So your kidney is going to be there working hard to make sure that system in a run sawa, all right? So that the waste products, which is mainly water and things like urea and some electrolytes, are able to be removed in the urine. So once the kidney makes urine, it sends it via the pipe that is a ureter down into the bladder. All right. So the bladder is a storage tank. All right. So it keeps the urine until you're ready to go. You know, you get the washroom, then it goes out through the urethra. So that whole system is your urinary tract. So when you get some sort of bacteria, mostly in the system, they can cause infection, which can develop some symptoms, which is what we're going to be talking about. But it's good for us to have an idea.
A clear picture. Back to our biology classes, guys.
Yes. So ideally, your urinary tract has normal God-given defense mechanisms to keep you from getting infections. So when those mechanisms are overwhelmed, then now you can develop a urinary tract infection. Yes.
So what basically causes UTI? What basically causes UTI?
So basically, mostly UTI is caused by bacteria. So there are different types of bacteria. The main type of bacteria, if you remember your biology classification.
I can't remember.
So we call it, the Latin name is Escherichia coli, or E. coli in short. All right. So there are different other bacteria that would cause. So 80 to 90% of urinary tract infections are caused by that bacteria. And that bacteria is found in your gut. So where the urinary system is, especially in women, it is next to your reproductive system. So that bacteria can be found, and also next to your urinary system is the other system where food comes out from, all right? So those bacteria are found around there. So if there is some contamination, the bacteria can easily go up the urethra, especially in women. These kind of infections, it's good to say, are more common in women because women generally have a shorter urethra.
Yeah.
All right? So from the opening to the bladder, it's about 4 centimeters. it's much longer in males, about 20 centimeters.
Okay.
All right. And in males, it's a bit tortuous because of our anatomy. So those kind of bacteria can go up into the urinary, into the bladder, and they can cause infection. And we're going to be talking about that.
So basically what you're trying to say is that hata wanaume wanaweza get UTI.
It's not very common. For in kids, it is still more common in girls, about 3 times more than in young boys. So we have, but in older, in adolescents, in adults, it's 10 times more common in women than in men. Then later on, when we are retired, the ratio almost balances. So it's almost 1:1 women to men, because men start to develop prostate issues, which are a major cause of urinary tract infections. And then women, at that time, because the estrogen is going down, they also tend to get a bit more. So they tend to be almost balanced. But more often than not, women are the ones who tend to get urinary tract infections. And just to classify a bit further, the upper urinary tract infections, you talked about the kidney up there. All right. So the upper urinary tract infections will affect usually the kidney. They tend to be a bit more severe. And then the lower urinary tract infections affect mostly the bladder and the urethra going down. And in men, you may have infections in what we call the prostate gland. Yeah.
Wow. And maybe Daktari, help us understand a bit the difference between UTI and also STI and how it affects our body.
All right. So basically, UTI and UTIs are not STIs, and STIs are not UTIs. So urinary tract infections will start in females, and we'll talk about males. So in females, we've talked about your urinary system. Basically, just like in males, is your kidneys, your ureters, your bladder, and your urethra. So infection along anywhere along there is urinary tract infection. Then we also need to just understand a bit about the reproductive system in females. So you have your vagina, we have the uterus, we have the fallopian tubes and the ovaries. So sexually transmitted infections usually it tends to affect that pathway. So either you most commonly will find a patient with vaginal discharge. So most times, if there is a vaginal discharge, almost always, then we're not dealing with a UTI. So we are probably dealing with a sexually transmitted infection, of which the common ones would be chlamydia and gonorrhea. There's another common one as well called trichomonas. Or we'd also be thinking about, so in that case, the discharge tends to have a bad smell. It's quite itchy. Sometimes may not be itchy. You may have some lower abdominal pain, and you may have discomfort when having sex and things like that. The other thing that it could be that ladies tend to commonly get is candidiasis, where you tend to have vaginal discharge that is whitish, that is thick, almost like maziwa mala. So that as well is not UTI and tends to be very itchy, and the itchiness may even be on the outside, on the vulva. So that is different from urinary tract infections, and the treatment is different. And in that case, when it is a sexually transmitted infection, we may need to do vaginal swabs or a urine test to try and identify those particular bacteria that cause this kind of infections. And in such cases, even the partner may need to be treated. And usually we advise that the patient needs to abstain until the treatment course is completed. So that's completely different. And this kind of sexually transmitted infections are the ones that can now lead to problems like infertility. You know, it's a really big cause of infertility in women
if left untreated.
That's right. But urinary tract infections do not cause infertility.
Thank you for that clarification.
All right. And urinary tract infections often, almost always, you do not get vaginal discharge unless you have both a urinary tract infection and a vaginal infection, which may either be sexually transmitted or candidiasis, or sometimes the disruption in the normal bacteria in the vagina can lead to development of an infection which we call bacterial vaginosis, which may not quite be, it's not quite STI, but also is treated with some different types of antibiotics. So it is important sometimes to distinguish. You may not be able to differentiate when you're at home, when you're, having lower tummy pain, because some symptoms may overlap. Like, for example, in both STI and UTI, you may have some lower abdominal pain. So in UTI, the pain will probably be in your bladder, but in the STI, the pain will probably be in your uterus. So it may be difficult to distinguish that. So sometimes you may need to get your clinician involved to try and help to make the distinction and to give you the appropriate treatment. Yes.
And you've talked about the abdominal pain for women. Is it the same for men, or how do men experience that, or how does it affect men?
Good question. So we said men, because of the long urethra, they typically do not get kawaida UTI. All right. So men may get UTIs from other things. Maybe you have an infection somewhere else in the body and the infection spreads through the blood, and then you may have some burning pain when passing urine. But if there is a discharge coming out from the man's penis, then commonly it tends to be an STI. All right, and we may need to get a sample of that. We may need to do a swab, examine that under a microscope in the laboratory, and then be able to give them an appropriate course of antibiotics. So in men, if there is a urethral discharge, then it is more commonly tends to be STI. UTI in men is not a very common thing. A few times you can get it because of prostate infections, especially in older men or in younger boys, because of some abnormalities in the urinary tract. If there's a blockage somewhere and things like that, then such boys can get urinary tract infections. But in adolescent and adult men, kawaida UTI is not very common. Yes.
Quickly take us through the signs and the symptoms. How do I know now I'm at home I have UTI and it's not even STI?
All right. The very common things would be you would probably be running to the washroom more times.
See, maybe I've taken lots of water.
Even when you take lots of water, so you probably pee more frequently and you'll have the urge to go more frequently. And sometimes you feel like you can't hold as much as you used to. All right. So what we call urgency, you feel like you have to go and you have to go. Sometimes the urine may smell funny. Not that it smells nice usually, but it may smell funnier. May have some bad smell. You may notice some blood in the urine, and then you may have some burning sensation when you're passing urine. All right. Sometimes you may have some lower abdominal pain. That tends to be those symptoms are mostly if it's a lower urinary tract infection, so your bladder going downwards. And then if the infection involves the kidneys in both men and women, then you may have some side pains on your tummy. You may have some back pain. You may have some nausea, some vomiting. You may have fever, which is a temperature of more than 37.5 degrees Celsius. And you may really feel fatigued or, weak because of that infection. Some patients can get very sick because of UTI, what we call severe UTI, and they come with very high fevers, even fevers of up to 40 degrees or more, and they may come, they're very lethargic, they are not able to retain anything in their tummy, they're vomiting a lot, their blood pressure is low, their heart rate is high, and things like that. And such kind of patients patients may need to be admitted for treatment. But most patients do not have severe UTIs. So most patients just have those symptoms that we've mentioned, the problems with passing urine, basically. Yes.
At what point do you know that you have severe UTI because of the symptoms you've mentioned? Oh my goodness.
So basically, the severity of symptoms we've mentioned, like high fevers, and of course the changes in your blood pressure and pulse will have to triage you when you come to the hospital. And then, of course, we may now need to do further testing, which we're going to talk about, I think, a bit later. So we have to combine both the signs and symptoms and how you're feeling and examine the patient, and as well as the results from the tests that we'll do to be able to determine that. Yes.
Thank you so much for that. If you have any questions,
things like HIV, things like some autoimmune diseases, we may also need to find out if they have, are we really talking about UTI, or could it be an STI? Because sometimes people could get it mixed up, and we may need to just differentiate that. Sometimes there are problems with the bladder that we could be trying to call them UTI, but it's not really UTI. We may need to probably do some more scanning to try and see, could there be, a bladder lesion like bladder cancer? Could we have like things like kidney stones or bladder stones and things like that could cause recurrent UTIs? We may also be looking for, some people may have some disorders affecting the nervous system that could cause recurrent UTI, like multiple sclerosis, and some people could also have other disorders that they've had since childhood that we may diagnose by doing a couple more tests. So there are many causes of recurrent UTI, but we may need to do an extensive workup to just try and figure out and probably get a more comprehensive, history. When did it start? How does it look like, and things like that, just to be able to make sense of what could be the underlying problem.
So it's very important for someone to just go get checked.
Yes, that's right.
We also have someone who says, Cynthia, I'm loving the conversation. Ebu, ask the doctor, I'm always having recurrent UTI and I get treated, but my partner doesn't. Does that mean that it is actually transmitted? Well, if it is truly just UTI, then you cannot get it's not transmitted directly from your partner, because as we said, men don't tend to typically get kawaida UTI. When a man has a UTI, we're thinking, could there be other issues? So what could be the issue is during sexual intercourse, some of the bacteria around the vagina or around the anal region could be transferred near the urethral opening and go up into the bladder and cause infection. So typically then we would advise women to, take lots of water after intercourse, and, take a shower, and make sure, of course, they're keeping, good hygiene, cleaning front to back rather than back to front and things like that. But usually, and we get this a lot, two people come in and you do a urine test for the man and it's completely normal, and she's wondering, where am I getting this from? So if there is a vaginal discharge, then we would need to probably do some further testing to look for sexually transmitted infections, so we may need to just distinguish. And most times when women have UTIs, your partner doesn't need to be treated. But if you have an STI, then your partner does need to be treated. So it is unlikely that if it's just plainly a UTI, that the partner is involved, apart from probably during sexual intercourse. But if that's not the case, and usually then you tend to get the symptoms a day or so after after the act. So if it's not related to that, then it has to be something different, and we have to be doing further testing to figure out what's going on. You've talked about something on hygiene, and it's important for us to understand, are there any hygienic measures that prevent a UTI?
Definitely. We just like I've mentioned, of course, I'm surprised you haven't asked this about toilet seats.
Yes,
you know?
I was going there. The relationship between toilets and UTI, you know. Me
yes.
at times by there I've seen ladies kule washroom.
Yeah.
Tunaeka tissues mingi sana because of reasons known to them.
Yeah.
So you're gonna tell us more about that.
Yeah, so it's actually a controversial subject, but I have seen, some data that it does. It can cause infection. Not the toilet seat, but of course, if the bacteria, if it's not clean and the bacteria get in, around around that area, the bacteria, of course, can ascend into the urinary system and cause an infection. So definitely having a well sanitized, toilet seat, and those are things that are important, and as well as even the water in the bowl. If the water gets into contact, with that area and the bacteria ascend, so that can cause infection as well. So it's important to be careful about the hygiene of the places we're going to.
We also have another question here. Ask the doctor, Cynthia, every time I get pregnant, I'm always getting recurrent UTI. I don't even know where the problem is because I tried treating it, but it's very difficult for me to get to the doctor every time discussing about the same matter. Pregnant women with UTI.
Yes, so pregnancy is a very interesting state. It's a wonderful thing, because finally bouncing baby boy, bouncing baby girl, God willing. But what happens, there's some hormonal changes in pregnancy that do, increase the probability of women getting UTIs, and women tend to retain urine more because of a bit of swelling, and one of the things that causes people that we should have mentioned to get UTI is not peeing a lot, because when you retain urine, the bacteria have a greater chance to multiply, zinapiga sherehe, and they cause infection. But if you're if you feel pressed, ideally you should be able to quickly go to the bathroom. So there are those hormonal changes that cause ladies to get urinary tract infections, and just some more changes in pregnancy. So, and we're usually concerned because that can cause complications if not treated. So that the ultimate treatment is to deliver, so that your body goes back to factory settings. But until then, we have to do those routine urinalysis checks just to be able to see what's going on. If that persists even after pregnancy, then we'd have to be looking for other causes. So take a lot of water. Cranberry juice can help. There's data that it can help and things like that. Making sure your hygiene is on point. And if you get symptoms, making sure you can contact your doctor as soon as possible.
Are there good and bad bacteria?
Yeah, definitely the good bacteria, what we call the normal flora. So these are basically the microorganisms that either bacteria or fungi that are found around the skin or in the mucous membranes, and they're just there, they're just chilling, azisumbuani na mtu,
they're having good time,
pressure, and they have lots of benefits, like in the gut, they help with digestion and things like that. So commonly around the genitourinary tract, there's what we call lactobacilli and what we call staphylococci. So hizo ni bacteria tu hatusumbuani na mtu.
Umesema kuokoka.
Ziko tu pale. Then we have the bad bacteria, the ones that now we call them pathogenic. Zile sasa vichwa ngumu zinasumbua, and they cause infections. The common one we talked about, E. coli. We have others like Staph saprophyticus, like Klebsiella, like Proteus mirabilis. So these are the bacteria that now do cause, and of course we have other bacteria like the ones that cause STIs like chlamydia trachomatis and Neisseria gonorrhea. So those kind of bacteria are the bad guys, and those are the ones we are more concerned about. So in a urine culture, if we are seeing any of those bad bacteria, then we know how to deal to give the appropriate treatment. Then if we are seeing the normal flora, then we are wondering, is it a contaminated sample or something like that? Yeah. Yeah.
And our last question is, there's so many people who maybe are asking out here, because when you talk about UTI, so many things come on people's mind, and someone needs to know, can recurrent UTI maybe cause kidney or cancer function problem,
Not quite. If it's an untreated UTI, it can cause some element of kidney failure, but that tends to be as well not too common. But kidney cancer usually tends to be genetic. If you're talking about bladder cancer, the risk factors would be things like smoking, especially in women, would be some kinds of infections like bilharzia, caused by some bug called schistosomiasis. We'd be thinking about, so those are also be some of the things that would be contributing to bladder cancer. Things that would probably cause chronic, long-term irritation of the bladder would probably be associated with bladder cancer. Yeah, but urinary tract infections shouldn't cause bladder cancer or cancer of your kidneys. Yeah.
Okay. And how can the treatment done? Is there even permanent treatment for UTI?
The answer would be not quite. We can be able to resolve the current infection. If you're having a bout of UTI, we can be able to give, if it's a mild or moderate UTI, usually we give some oral antibiotics. So there are different choices that you can give. There are some that are there's even a 1-dose antibiotic. You just take 1 dose and that's it, like phosphomycin. We have others that you'd probably take for like 3 days, like cefuroxime and, nitrofurantoin and augmentin and things like that. Then if it is recurrent infection, we may probably want to use stronger antibiotics, probably for a week or so, like ciprofloxacin. However, when the infection does clear within a couple of days, but if, for example, there's a structural problem somewhere in the urinary tract, you may get a recurrent infection. Or there are other things that we should have talked about that would predispose you to getting another infection. So if hygiene is not very good, if you're not hydrating very well, wale watu maji ni luxury,
wanakunywa kwa chai,
iko tu na kwa supu. So we need to take lots of water, at least 2-3 liters a day to be able to, and you need to go to the washroom. When you need to go, si ati niko na kazi mob and I need to sit on this and finish the whole day utaenda washroom. Those are things that would cause UTI. So we talked about hygiene after sex for ladies. So there's other things in women who've reached menopause. So because of low estrogen, they may get lots of UTI. So probably they may need to talk to their doctor about estrogen replacement. So there are different things that you can do. If there's any underlying illness like diabetes, those things may need to be treated, so that, because patients with diabetes, because they tend to have sugar in their urine, they tend to get lots of urinary tract infections. So that would need to be treated as well. So the other thing, there's some types of contraceptives, what we call diaphragms, or some, if the condom is not well lubricated, and things with spermicides, they can increase your risk for UTIs. So you may need to adjust that. Then there's also, for women, things like douching, may contribute to recurrent UTIs. Using deodorants and soaps down there can be problematic.
Sex toys.
Well, I'm not sure about labda ulisoma mahali unaweza tuambia. But those tend to be the things that you need to check on, just to prevent recurrent UTI. And a bit of cranberry juice, if it's not, it can give you a bit of tummy issues sometimes, a bit of diarrhea. But if you're not getting issues, you can take cranberry juice.
Plain yogurt.
Yeah, because of the probiotics. So yogurt is good. And then just a disclaimer for if you're taking cranberry juice and you're on, some blood thinners like warfarin, unaweza need kucheza chini because of the drug interactions. Yeah, but those would be some of the things that you can do to prevent you from getting UTI. And if there's a vaginal discharge, you may need to go and have it tested and see if there's anything else going on. Yeah.
96.9 FM, Pearl Radio.